Alright, welcome back to ABA Exam Review and the continuation of our BCBA practice question series, where we're going through another set of questions together and breaking them down. If you're new to the channel, welcome. If you're returning, welcome back. Please like and subscribe. Check out behavioranalyst.study.com for all of our study materials, including our combo pack. When you pass your exam, let us know so we can include you in the Sunday shout out. Work hard, study hard. Let's get going. A behavior analyst is developing a comprehensive behavior intervention plan for an adolescent client. Which of the following components is essential to include as it guides the selection of all other intervention strategies? Starting off with a short, relatively straightforward question. The question wants to know what component is essential for a BIP as it guides the selection of other intervention strategies. Now, first, there are a few essential components of a BIP. So what we want to focus on is this idea that this particular component is going to guide the selection of the other intervention strategies. So if we look at a precise operational definition of the target behavior, you always want to operationally define behavior either in the BIP or the skill acquisition plan, but it's not necessarily going to guide intervention strategies. What that operational definition is more focused on is measurement. So we can start to reliably and accurately and validly measure our behaviors. That's what that operational definition is focused on. More so measurement, consistent, valid, fidelity, and measurement. B, a list of specific reinforcement schedules to be used. Well, it just depends. What if you're using a punishment extinction strategy? You wouldn't necessarily have reinforcement. Should you include reinforcement? Sure, but if we're just using extinction, that might be different altogether. And there might only be one reinforcement schedule. So that reinforcement schedule, one, might not be essential depending how the BIP is written, and two, is not going to guide other intervention strategies. C, the hypothesized or demonstrated function of the behavior. Yes, the function is the most important part to a BIP. This is going to guide, do we use reinforcement? Are we using extinction? Are we using punishment? It's going to tell us why the behavior is occurring and how we should treat and intervene on that particular behavior. And then D, procedures for implementing timeout. Timeout, of course, is its own intervention. It's not going to guide other intervention strategies, and it certainly isn't essential. So the component here that is essential to include because it guides selection of other intervention strategies is C, the hypothesized or demonstrated function of the behavior. A behavior analyst is conducting a functional behavior assessment for a child who engages in aggression towards peers during free play. The analyst uses a descriptive assessment, observing the child in the natural environment and recording antecedents, behaviors, and consequences. The analyst notices that aggression often occurs immediately after a peer takes a toy from the child and is often followed by the peer returning the toy or a staff member intervening. This assessment primarily provides evidence for what? I really like this question. It's a good teaching question. It's a good way to understand what our different assessments do, and that we always need to remember that we're not trying to prove too much with this type of assessment. Now, what do I mean by that? Well, if we're conducting an FBA for aggression towards peers, and we're using a descriptive assessment where we're looking at the child and observing antecedents, behaviors, and consequences, are we actually intervening here? No. Are we conducting a functional analysis? Are we actually manipulating antecedents and consequences? No. It's a descriptive assessment. We're just observing. Now, the analyst notices aggression occurs when? After a peer takes a toy from the child and is followed by the peer returning the toy or a staff member intervening. Have we noticed a functional relation? We have not. What we've noticed is a correlation. A functional relation often implies causation, where we can prove or somewhat prove that our observation or our behavior is tied to something in the environment. And how do we do that? We do that through experimental design. We do that through measurement. We do that through intervention. When we are just observing and using something that is descriptive, we're looking more at a correlation. So if we look at a direct functional relation between territory taking and aggression, there appears to be a relationship, but we have not yet experimented or intervened or measured anything where we can say for sure there's a direct functional relation. To prove a direct functional relation is not an easy thing to do. So this observation is much more proving B, a correlational relationship between specific antecedent consequences and aggression. Now that correlational relationship might lead us to further investigating and intervening. What about C? Because we always read all of our answer choices. The internal validity of a potential intervention. Well, we don't know yet, right? All we've done so far is observe. We haven't tried an intervention. We haven't even done a functional analysis as far as this question is concerned. D, the automatic function of the aggression. Do we know the function yet? No, we've probably have made a prediction. We probably have a hypothesis, but we haven't yet done anything to prove a function. So we can't say for sure whether this is automatic, tangible, escape, whatever it may be. This assessment primarily provides evidence for a correlational relationship. Don't use assessments to try to prove too much. Just use assessments to prove what you can prove based on what was observed or done. A child frequently tries to bite their shirt collar. Whenever their hand moves towards their mouth with their shirt, a caregiver quickly and gently places their hand over the child's hand, preventing the shirt from reaching their mouth. The caregiver does not say anything, nor do they remove the child from the activity. This intervention is an example of what? All right, another fairly straightforward question, but again, it's a good learning opportunity, right? We're looking at an intervention where you have a child biting their shirt collar, and whenever they get ready to bite that collar, what does the caregiver do? They place their hand over the child's hand, and they prevent the shirt from reaching the mouth. In other words, child wants to bite shirt, caregiver prevents shirt biting from happening, right? Pretty clearly, this is response blocking. And if you're fluent at all, that's going to be a pretty clear idea. Now, what might make this question tricky? What might make this question tricky is the common mistake of confusing extinction and response blocking. Response blocking is exactly what it looks like. We are stopping a response from occurring. Extinction is when we withhold reinforcement from a response. And extinction can take the form of many different things. We can prevent escape. We can withhold tangibles. We can prevent automatic or sensory sensations. We can withhold attention. Extinction takes the place of many different things. It doesn't necessarily mean preventing a response from occurring. And oftentimes with extinction, we want that response to occur so that we can withhold reinforcement. This is much closer, or is, response blocking. Why is it not B, physical guidance? Because physical guidance is a prompting activity. The caregiver is not prompting or guiding the child to do anything. They're preventing it. And negative punishment. If anything, response blocking would act as a positive punisher because we are adding something as a consequence. So this intervention is an example of D, response blocking. A company wants to increase participation in its voluntary wellness program, attending fitness classes, using healthy cafeteria options. They announced that if, out of the whole office, 75% of employees participate in a wellness activity each week, and everyone in the company will receive an extra hour of paid time off at the end of the month. This type of group contingency is best described as what? So we have a group contingency question, and our three group contingencies are independent, where if you have a group of 4, each person is responsible for themselves. So 1 is responsible for 1, 2 for 2, 3 for 3, 4 for 4. If 1 does it, they get the reinforcement, so on and so forth. Dependent group contingency, if you have a group of 4, you have a chosen person or small subset of the group that the whole group is responsible for. So in this case, 1 and 2, or just 1, is responsible for the whole group. If 1 does it, the whole group does it. Or if 1 and 2 do it, the whole group gets the reinforcement. Interdependent says if you have a group of 4, everybody's responsible for everybody else. And the hero procedure is tied to what? The hero procedure is tied to dependent group contingency. Now, in this case, we have to look carefully at the words. The company says if out of the whole office, so we already know we're using the entire group, out of that whole office, they have to meet a criterion of 75%. If the whole office, regardless of who it is, gets to that criterion of 75%, everybody gets an extra hour of paid time off. So since the whole office is responsible for the rest of the office, we haven't picked or chosen a specific person or subset. This is going to be interdependent. Because if 100% of the office does it, then everybody gets it. If 75% of the office does it, everybody gets it. It doesn't matter who. The whole office is dependent on the entire other people in the office. So this type of group contingency is best described as interdependent. An independent would be each employee responsible for themselves. Dependent would be a pre-chosen person or group of people who must complete the task. A behavior analyst is teaching a client to brush their teeth using a task analysis with backward chaining. During training, the behavior technician consistently uses physical prompts to guide the client through the final step, but never fades those prompts. What issue is most likely to occur? Okay, straightforward prompting question. So I would say we've had 2 more difficult questions and maybe 3 relatively simpler questions. On the exam, not every question is going to be extremely hard. Not every question is going to be extremely easy. You just have to answer the question in front of you. So in this case, we have a behavior analyst teaching a client to brush their teeth using a task analysis. And during the training, the behavior technician is using physical prompts to guide the client through the final step, but never fades those prompts. What is going to happen if we don't fade out the prompts when guiding the client through the final steps? Well, A, generalization will occur too quickly is unlikely, right? We want generalization to occur, 1, but if we're always using prompts, that doesn't necessarily increase the chances of generalization. B, the client may become prompt dependent. Yeah, if we're never fading the prompts and we're using physical prompts, prompt dependency is likely. C, the response may extinguish due to lack of reinforcement. So that would be possibly an extinction procedure. Just because we're prompting doesn't mean we're not providing reinforcement. So C is out. D, the skill will be generalized but not maintained. Again, we're focused on the prompt here, the overuse of physical prompts, and the overuse of these physical prompts is much more likely to cause prompt dependency than anything else. Thanks for watching. Check out behavioranalyststudy.com for all of our study materials. When you pass your exam, let us know so we can include you in the Sunday shout-out. Work hard, study hard. See you soon.